Okay. Good morning. Welcome to, I'm Dr. Dick Walker, and this is my Saturday morning interview with a healthcare professional, and we've got a great guest this morning. It is, I believe, September the 19th, and this will be recorded if you want to use it later on. So my guest this morning is Dr. Wei Lin. He's an internist from Tri-Cities, Washington. And I think instead of trying to give you his credentials, I'm going to let Dr. Lin tell you a little bit about himself, how he ended up being a physician, education, that sort of thing. And then we'll chat with him about a few issues regarding ASEA and redox. So Dr. Lin, tell people that are watching this morning who you are, what you're about, and then we'll kind of have some fun here this morning.
So yeah, hi everybody. I'm Wei Lin. I grew up in China. I went to medical school in China and then came here for a PhD. Went to University of New York in Buffalo. After I got my PhD, I passed the board and went into residency in internal medicine at Duke. So once I finished the internal medicine training, I moved to the West Coast. So I practiced for 15 years in Portland, Oregon, and then 10 years in Tri-Cities, Washington.
Great. So conventional education in internal medicine and more or less a conventional internal medicine practice. So were you a physician who was really interested in alternative things and supplements, or how did ASEA attack? How did that catch for your attention?
Well, as an internist, especially in an area where an internist really gets a lot of referrals of patients where other healthcare providers have seen and couldn't find answer for, and of course, I didn't have any more answer than they did. I just noticed that there are a lot of illnesses where the conventional medicine could not solve their problem. And, they're like in a mash, they couldn't get out of. So we need to be looking for a bridge to get them out. So it is really something that's coincidental or fortuitous that my next door neighbor, you might have met him. So he was a respiratory therapist, but he himself went through a lot of illnesses himself. That he started telling me a product related to the redox signal molecules. So every now and then he would send me a few videos of a product, but I would say, yeah, but where's the randomized controlled double-blinded study from all that. So I had put it away until one of my patients, whose husband is a dentist and also a very scientifically minded dentist. So his wife happened to have a number of medical illnesses that for which she has seen a lot of specialists, but just couldn't get better. So I tried my hand and I couldn't get her better. So finally I said, well, we just have to try something outside of the box, because everything inside the box is either not effective or make her even sicker. So she's on the list of medications, probably longer than the whole page rap sheet. So I said, there are a couple of things that I've heard about. One of them is called this redox signal molecule. So I haven't used it. So if you do some research and see what you get. So 3 weeks later, Dr. Osler sent me a message and say, you wouldn't believe what happened to my wife. It's almost like a switch turned on. Now, I mean, sometimes people may say that, yeah, but she just happened to get better right at that moment. They have nothing to do with the ASEA. But knowing that she had been sick for more than 10 years, and she hadn't had 2 weeks of being well string together. And for her to have a light switch turned on and being feeling good or much better for 2-3 weeks straight, that is earth shattering to me. So I started communicating with Dr. Austin Moore and find out exactly how she is better. And then I talked to my next door neighbor who had been recommending me the products. So I said, well, before I recommend it to my patient, I'm going to try it myself, because I was going through a time that I felt I was kind of more tired than usual as well. So I started taking ASEA for myself, and I did feel that I was better and then I started recommending to patients, especially to those who we have tried everything and just couldn't get them better.
And I think you, at least I've attributed a quote to you, something about when what you're trying isn't working, don't throw science out the window. You know, how do you say that? It's a very effective way.
Yeah. So I think so when regular science does not give you the answer, don't throw away science. You just have to look at better science.
That
So,
is, I love that quote.
yeah. So we a lot of time, I think in the medical field, of course, the randomized controlled trials are very important to help us distinguish whether there is something that's helpful from real effect to from those that are from the other confounding factors or placebo effect. But the randomized controlled trial has become such a manipulation of statistics, such that we can see a relative risk reduction, a relative benefit of 20% is actually a actual benefit of like 0.5%. But then they're being sold to us as a 20% reduction or something. So the and it costs a lot of money to do those science for just treating one single condition. So when I looked at the science behind ASEA, the redox signal molecule, you really see that it is very foundational in how health and illnesses happen. That is that, I mean, almost everything that happens in our cells has to be very well regulated, like a well-oiled machine, as we usually say. It's actually better than a well-oiled machine. Even as we speak, every single syllable that I make involves so many synapses communicating, and all that in a split second is coordinated by chemical reactions involving these small molecules. So when we are lacking in any of these small molecules, it's very easy to say that, see how we get sick. And I see a lot of problems that are associated with the immune system. Either a overzealous immune system attacks our own tissue, or a inadequate immune system that couldn't defend our body. And I think that's I've used a graph that say, when you either call for a ambulance, but instead a fire truck and the police come and they started spraying your house with the hose, that doesn't help you. I mean, that's what when the signal is wrong, then that's what happened with all the excessive inflammation and autoimmune disease. I'm seeing more and more of those problems. And I also see that when patients use the ASEA, those problems get better.
Great. And your neighbor, Chuck Grijalva, I know is the person who was educating you, over the back fence or at the barbecue or whatever.
Yeah.
Talking to you about these molecules. And I know his story was one of geez, I don't think this stuff is going to work, until he got to a point where he was desperate, and then they helped him a great deal, I know.
Mhm.
But I think at one point in your life, I think the molecules really helped you a great deal. Could you,
Yeah.
just explain briefly, how sick you were and how much these molecules benefited you? Because I'm sure that really cemented your belief in the efficacy of this.
Yeah, exactly. So I had to go through a liver surgery. That was very soon after I started taking the molecules, about two months or so. So I know the illness didn't come from molecules. Whatever happened, the bad cells that were found in my body would have taken, say, about 12 months to 14 months to have grown to that size. Now, remember I said I was feeling a little tired before I started taking the molecule. I just didn't, as a doctor, you should have done the checkup on yourself, but I didn't. I just thought that I was being too busy and therefore got run down. But actually, there are some bad cells already growing in my body. So the long and short is that I had the surgery, and unfortunately, after the surgery, one of the small artery that should have been clipped off for that surgery wasn't completely tied up. So I bled about 2 or maybe 2.5 liters of blood overnight, and and the resident doctor did not recognize that was bleeding inside the abdomen. Just thought that it may be some bowel ileus or whatnot. So try the NG tube, try everything. Tried to give me some fluid, but could not correct the hypotension. My blood pressure was down to 70/40.
Oh,
Um, so I was hypotensive for about 16 hours before they actually got onto it. It was during the morning routine lab, and they found, your blood count had dropped a great deal. So, but through the whole course, even with that blood pressure, I think the reason why they didn't think I was actually in hemorrhagic shock was because I was maintaining so well. I was, and I forgot to tell my answering service that I was not on call. I was actually getting pages about patient
while you
that
were,
evening. So I was still, answering those pages and telling them, no, I'm not on call. I'm actually in the hospital for myself.
yeah, desperately.
So
Yeah.
yeah. So after at the surgery to stop the bleeding, I had to be transfused 4 units of blood. That's 2 liters of blood.
Right.
I think they put in about 10 liters of fluid plus fresh frozen plasma, albumin, everything to get me back.
To
And
stabilize. Yeah.
yeah. And I had the creatinine went up to 5.8 or something like that. So the kidney almost completely shut down. So, but how fast I recover was amazing. I mean, everybody who saw me 2 weeks after that, I spoke at the church for about half an hour standing, and had a deacons meeting in the afternoon. I entertained my family visiting me from out of town. So it was almost a 8 to 10 hour day for
Wow.
that day.
So how much, so after you got out of the hospital, or maybe you were drinking it while you were in the hospital, how much of CO were you taking at that point?
So after I found out the diagnosis, I started drinking 16 ounces a day. So I think that kind of prepped my body before even going into the surgery. So the doctor, the surgeon said, "Well, you must be in very good shape because right after the surgery, because there was a lot of blood in my retroperitoneal space, So my diaphragm, I couldn't even pull in 500 cc in a breath, but I was able to get up and walk and maintaining very well, even when my oxygen got down to low 80s. So he said, you must be in very good shape, because most people couldn't handle that kind of low blood pressure, low oxygen, and still maintaining so well. I said, well, I think it's mostly from the supplements that I was taking. So it helped my body really in a time of crunch time to use the resources in the best way. I mean, protecting the most important organ, my brain.
And your kidneys actually too, probably.
Yeah. So my kidney function over the next about 4 weeks or so returned to completely normal. So
that's amazing, because as a physician, and if there's any other physicians listening, they can appreciate how desperately ill you were after that surgery, and how you could, the story could have been very different, I think, if it weren't for redox molecules. Your course would have been much more prolonged, and who knows whether you would have recovered, and who knows whether you would or would not have had some mental challenges from having such a low blood pressure for so long at your age.
Yeah.
So let's talk a little bit about the importance of cellular health. And, one of the things that's happened for me is I've always appreciated how effective our body is at the cellular level to keep us healthy. But I don't think I ever had a true understanding of how important and how effective our cells at recovering from really significant problems. Could you comment on cellular health and how we don't often think of health at the cellular level, but how important is that? I mean, why should we focus on that?
Well, because we are what our cells are. If the cells are not functioning on top of their game, we wouldn't be able to. I mean, I've seen so many people who are tired or in a state of suboptimal health, or just being tired all the time. But when you do their blood test, they don't seem to have anything that you can identify being abnormal. So I think in a way, it's like having had a major snowstorm. It covered everything. And then you could have the plow truck that plowed the major thoroughway, like in our bloodstream. The chemistry can be sort of maintained okay. It's like your plow truck has plowed the major throughway. But in all the houses, your driveway and in the back alleys, they are still covered with snow. You don't see it just by running some blood tests, because you have cleaned the bigger arteries, clean the major throughways, but you haven't cleaned the back alley. People still cannot get out. You can't even pull out your driveway because they're still backed up with snow. And in our for us to be able to function optimally, all those have to be removed. And we are, as I was saying, I mean, when we consider that every single decision we make, every speech we make, every movement we make, or even every single thought that we have to be communicated by chemical reactions that happen within milliseconds. It's quite amazing that things can be coordinated so well. If one of the reaction lasted longer, for instance, when our muscle contract, you have the calcium influx, and then immediately it has to relax in order for us to, our heart to be able to, suck the blood back in. That calcium has to be removed again. And then the next beat comes in, the calcium has to be brought in again. I mean, it has to be all organized and in such harmony that, and it's all done by chemical reaction, is amazing.
Yeah, the more I study redox and the more I go back and study cellular biology, the more amazing it is that it all actually works.
Yeah.
It is so complex and so interactive and so integrated, and it has to be for us to be healthy. And when it's not, then we get sick, right? I mean, that's
Yeah.
what happens. All sicknesses are start at the cellular level. That's just so interesting, and I think a lot of people don't appreciate how important that is. I think you alluded to it in the beginning when you said, as a working in a referral center, you get a lot of patients referred into you by outside physicians, and they've tried everything, looked everywhere, tried to find what was going on. Let's just emphasize that a little bit. How do you see a lot of patients where they're sick, and yet you cannot, from a conventional medical standpoint, cannot pinpoint the problem? And then how important it is to have a technology where we don't have to pinpoint the problem. We don't have to have a specific test that indicates that the cells are in trouble. Is that a common situation for you?
I think it's quite common. It's way more common than people would realize or admit. We now, in China, the medicine that have been passed along had mainly go on in a speculative fashion, that they speculate it is because something in your body doesn't work well, but because at that time, people didn't understand exactly what was going on in the cells, so they only could speculate in a way similar to the Greek philosophy that I think, we're composed of these major elements, the fire, the water, all that elements. And when they were out of balance, and you get sick. And now, I mean, there was so-called a qi, but there's some truth to that, that is focusing on the part that we really could not test, but we know that there's something wrong. And then they got too speculative. But the Western medicine that started out with anatomy, having to look at a structure, a piece of muscle or the nerve, brought us into somewhat of a more correct path. But then as we go further and further down, I mean, for a long time, we thought that cells is the smallest unit in the body. And then we realize within the cells, there's just so many organelles in the cells, and they have to coordinate their function. And so the anatomy or the pathology by anatomy got us in the way that we isolate disease as to say it has to be related to one organ or one specific chemical, instead of understanding it as, what about just the cells that overall they are not coordinating correctly? So yeah, all the parts are there, but they're not coordinating correctly. And that's I think we don't have good tests for it, and we have to accept that. I mean, a number of years ago, when say something like the the people with chronic being fatigued or having pain all over the places, because we didn't have a test to find out what's wrong with them, we kind of all classify them as just being depressed, just throw some antidepressant on them and hope that it would help. But a lot of those people really truly are sick. We just couldn't identify what it is based on our available tests. Now, when people come in and ask about antidepressant, I mean, do we actually test whether the brain chemicals were high or low on that? No, there's no way we could test that. We're just saying that there are these chemicals in the brain, and we give you an antidepressant and hope that by raising one of them, it will help you. So Western medicine don't always have to be able to test and find some exact problem before they treat. Now, and when you go to deeper level, if what happens is in the cells, not outside of the cells, we can only test the blood or fluid that are outside of the cells. There's no way that we can test this what's inside the cell. So if inside the cells things are not coordinated well, we wouldn't be able to test. But fortunately, with the discovery of the redox signal molecule, which won the Nobel Prize for the group that discovered it, that we know that these molecules can do their job for the brief time that they live in the cells, and they can attack foreign invasion. They can help the cells signal correctly about repair and replacement, and therefore. And they have also shown that when these molecules are out of balance, the cells get in trouble. So these tells us that if we can somehow help these molecules to get an improved balance and amount, the cells should be able to do its own job of healing. We've all seen that our bodies, the setup of the human body or any animal body is capable of healing itself. Otherwise, I had a major surgery in the abdomen. If we don't believe the body can heal itself, who else would be willing to have a cut in the body?
Right.
Yeah. So we know that our bodies are equipped to heal itself, but when we're lacking the communication device to properly coordinate that process will be in trouble. So I'm really, after knowing about the redox signal molecule, I'm very happy to use it for and recommend it for people and say at least it's worth a try. You have something that you're sick, even though many specialists couldn't find out why you're sick, but you're sick because you're the person experiencing it. So if we can find where the sickness is by testing the blood, then it must be something that's inside in the compartment that we can test, that's in the cells. Then we have to try to find something that gets into the cells and let the cells do their job, so healing you.
That is absolutely so important. I sometimes feel guilty about the number of people before I really understood redox or redox. ASEA even came along. We used to label patients as hypochondriacs or having functional illness, and it was only because, and in retrospect, many of those, the vast majority of them, it was our inadequacy of understanding what was going on, because we don't have a test for many of these things. We can't look inside the cell, and we didn't even know about the importance of redox signaling. So many of those people that doctors oftentimes find to be problematic because they can't find a solution, but obviously there's still something wrong. We now have a solution for people, and or at least something that they can try. At least, is that how you look at ASEA? Yeah, is that if we've tried everything else and they're not getting better, maybe it's the cells that are having trouble, and if we give the body a tool that they might use to fix at the cellular level, that now we've got an answer.
Yeah, I wish I could recommend to more people at a stage before they get to be feeling so bad. Even now I'm feeling good. I'm still using it because I wanted to keep myself at a healthy level, not waiting when it gets to the level that I feel run down. I work full time as medical doctor in full time practice, and I think the amount of work outside of medicine, because with church and other issues that I'm very interested in, invested in, I probably work equivalent of 2 full-time jobs. I but but the way that I can still feel so good and my brain can function so well with all these different areas pulling on my responsibilities, that pulling me aside so many different directions. I really feel that continuing with DSC has helped me a great deal. And when I caught the illness going around last year, that's what I used to get over it. My and my family. And I recommend to patients, who are suffering with, fever, fatigue, and all that, and they've reported that it make a big difference in their recovery.
Yeah, that's wonderful. So I just saw a couple of chats come through from Lee Osler, and Lee Osler, his wife was your patient, and it was you who introduced them and said, hey, maybe you should check out redox signaling. It's interesting that Lee's journey started there and it ended up here because he's now written a book called Redox Matters. I've read most of it, and it is the best detailed explanation of redox signaling and in fact cellular health and life, that if you're really interested in this, and I'm sure you've read the book, and you want to comment on, if you're interested in the science, is that where people should go to learn about the science, do you think?
Yes. I mean, Dr. Osler has really done a great job. And now, when I mentioned about redox to him, he has the interest of helping his wife, find an answer to get his wife healthier. But as a scientist, he went many steps beyond that. So most people would say, okay, we find a product and we just try to get to use it. But as a scientist, he wanted to say, how can we make sure other people who are in the healthcare profession, I mean, he used it in dentistry, in the healthcare profession, can use it for more, so more people can benefit. So bridging the gap between what happened at cellular level to what actually we can do to improve that. That's a very big gap. I mean, most of us, most physicians on that gap just depend on what the pharmaceutical company pushes to us.
And a lot of times I think giving physicians a little bit of an out there is that, when we're full-time practicing, quite frankly, most of us don't have the time to look around at other things. And so I want to applaud you for listening to Chuck, your neighbor, who kind of opened your mind a little bit. I think it was, I think your mind was prepared for that, perhaps because of your background and understanding of Chinese medicine and how that would sometimes be effective, even though you didn't necessarily, for centuries, that helped people, even though they had no scientific understanding of what it was doing. So I think your mind was prepared for that message, and I really applaud you for being open-minded and passing that on, and being willing to recommend it to people that you see who are struggling, and there is not an answer in Western medicine. So I really appreciate doctors like you who are open-minded enough to give redox a chance. And again, I want to close this out by our standard disclaimer, and that is that ASEA redox is not intended to cure, heal, treat, or diagnose. It is a product that your body, that is native to your body, and oftentimes your body can put to work so that it can maximize your body's own mechanisms for cellular protection and cellular repair. And in many cases, it can allow your body to do a much more amazing job than it has been doing without this supplement. So Dr. Lin, thank you very much. Is there any final words that you'd like to share with the people out there that are listening this morning?
Just that, as Dr. Walker had said, and as Dr. Osler had written in the book, that the science behind these redox signal molecules is very, very strong. So sometimes medical community had been reduced to thinking that only randomized controlled double-blinded study is the standard of science, but that wasn't the case when medicine started exploring new frontier based on understanding of the biology, of the physiology, the biochemistry. That wasn't the case when it started. And this is a just totally new frontier of health. And I just wanted to encourage other practitioners in any discipline of healthcare to give this a look and give it a try. You can try it out with your most, someone that you feel, there's nothing out there that's standard that can work. But even healthy people, I mean, I consider myself healthy now. I still continue using it because it helps keep my health optimal.
Great. Well, thank you very much for sharing, for being willing to share your thoughts and explain how effective it has been for helping people that you care about and care for. So thank you very much. And for those who are listening and watching, we will make this available through ASEA United and some other channels. So check your resources for that. And again, thank you very much. I'll be back again on the first Saturday of the month, trying to explain to people how these molecules work. And we'll interview another healthcare professional next month as well. So Dr. Lin, thank you again. And everybody out there, have a great day. And thank you for being interested in ASEA Redox.
Thank you.